Imagine you've been spending your hard-earned savings on a tiny pill that is quietly turning the very problems you're trying to solve into a faster, deeper decline. It sounds like a nightmare, but for many seniors, it is a daily reality. Over 60% of adults over 60 take at least one supplement that is actually hurting their heart, kidneys, or brain. How many of us are doing this without even knowing? In the next 19 minutes, I will reveal the 4 supplements you must drop right now and the 4 life-changing ones you should be taking every single day. Take a breath, because what you hear next could change the rest of your life. I'm Dr. Laura Martinez, a geriatric nutritionist with 20 years of experience helping older adults stay vibrant and independent. The supplement market is flooded with hype, glossy packaging, and promises of miracle results. Yet beneath the polished labels, many products hide ingredients that spark chronic inflammation, disturb electrolyte balance, or interfere with the medications you rely on. If you've ever felt confused by a label that reads natural or extra strength, you are not alone. Stay with me and you will walk away with a clear, science-backed checklist, what to ban, what to embrace, and exactly how to use the good ones. Let's first expose the hidden dangers that could be sabotaging your health. First on the list is high-dose vitamin E. You may have heard that vitamin E protects cells from oxidative stress, and many seniors reach for a 400 international unit capsule each day, believing it shields the heart. The truth is far more complex. Large clinical trials have shown that taking more than the recommended amount can thin the blood, raising the risk of hemorrhagic stroke in people over 60. In fact, 1 in 5 stroke victims in the recent meta-analysis had been consuming high-dose vitamin E regularly. Why does this happen in our bodies? Vitamin E interferes with the clotting cascade, making it harder for the body to seal a tiny bleed in the brain. The result is a silent vulnerability that only becomes apparent when a serious event occurs. So what should you do right now? If you are already taking a supplement that lists vitamin E at 400 international units or higher, stop it immediately. Switch to a modest dose of 100 international units, or better yet, obtain your vitamin E from whole foods such as almonds, sunflower seeds, and spinach, where the nutrient is naturally balanced with other antioxidants. Remember, more is not always better, especially when it comes to fat-soluble vitamins. The second dangerous supplement is calcium carbonate taken without medical guidance. Calcium is essential for bone health, but the form and dosage matter enormously after 60. Many over-the-counter products contain 1,000 milligrams of calcium per tablet, and it's tempting to take 2 or 3 each day to protect the bones. The problem is that calcium carbonate is poorly absorbed in older adults because stomach acid production declines with age. The excess calcium that isn't absorbed sits in the bloodstream, where it can deposit in arteries, accelerating atherosclerosis. Studies have linked high supplemental calcium to an increased risk of heart attack in seniors, especially when combined with vitamin D supplements that boost calcium absorption. Why does this matter for you? Your arteries are already prone to stiffening as you age, and excess calcium acts like a silent cement, narrowing the vessels and forcing the heart to work harder. The result is higher blood pressure, reduced circulation, and a greater chance of a cardiovascular event. The simple solution is to assess your actual calcium needs through a blood test, then choose a more bioavailable form such as calcium citrate, which the aging gut can absorb more efficiently. Aim for a total calcium intake from food and supplement that does not exceed 800 milligrams per day, unless your doctor tells you otherwise. At this point, you might be wondering how many other supplements are quietly doing the same thing. The answer is more than you think, and that's why I'm urging you to pause, reflect, and share your experience in the comments. Have you ever taken a high-dose vitamin E or a large calcium tablet? What happened? Your story could help someone else avoid the same pitfall. If this information is opening your eyes, give this video a thumbs up. It tells the algorithm that you value clear, evidence-based guidance, and it helps more seniors find the truth. Now that we have uncovered 2 of the most common threats, let's move forward to the next dangerous duo. But before we do, a quick reminder. The goal here is not to scare you, but to empower you with knowledge that lets you make confident choices about what you put into your body. If you're finding this valuable, hit that subscribe button and join a community that refuses to let marketing myths dictate health decisions. Together, we can navigate the supplement maze with science as our compass. The third supplement that often slips under the radar is high-dose green tea extract. Green tea in a cup is a wonderful low-calorie beverage rich in catechins, but the concentrated extract sold in capsules can contain up to 300 milligrams of epigallocattin gallate per serving. While the antioxidant properties are praised, research has shown that such high concentrations can cause liver toxicity in susceptible individuals, especially when taken on an empty stomach. The liver, already working overtime to process medications, can become overwhelmed, leading to elevated liver enzymes and, in severe cases, acute hepatitis. Why does this happen? The liver metabolizes catechins through pathways that generate reactive oxygen species when the dose is too high, paradoxically turning an antioxidant into a pro-oxidant. For seniors whose liver function naturally declines with age, the margin for error is much narrower.
The practical step you can take is simple. If you enjoy green tea, drink 2 to 3 cups a day and avoid the concentrated pills unless a healthcare professional has specifically recommended them for a diagnosed condition.
If you are already using a green tea extract supplement, discontinue it and monitor your liver function with your doctor. The fourth and final hazardous supplement on this side of the list is glucosamine combined with chondroitin in doses exceeding the recommended daily amount. Many seniors turn to these compounds to protect joint health, believing that a higher dose will mean faster relief. However, recent investigations have revealed that excessive glucosamine can raise blood sugar levels, a concern for anyone with pre-diabetes or type 2 diabetes, conditions that become more common after 60. Moreover, chondroitin can interact with anticoagulant medications, increasing bleeding risk. Why is this a problem? Glucosamine is structurally similar to glucose, and in large amounts, it can be mistakenly taken up by the body's glucose transporters, nudging blood sugar upward. For seniors managing blood pressure, cholesterol, and blood sugar simultaneously, this hidden spike can destabilize a carefully balanced regimen. The safe approach is to limit glucosamine to 1 500 milligram tablet per day, and only if you have no history of blood sugar issues. As for chondroitin, check with your physician before combining it with blood thinners, and consider obtaining joint support from omega-3 rich foods such as fatty fish, which have anti-inflammatory benefits without the sugar risk. We have now uncovered the 4 supplements that could be silently undermining your health. The next segment will shift the focus to 4 powerful allies you should be embracing every day to support heart, brain, and overall vitality. But before we transition, I want to hear from you. Which of these dangerous supplements have you been taking? Share your experience below, and let's learn from each other's journeys. If you feel empowered by this knowledge, smash that like button. It helps more people discover the truth behind the supplement industry. And remember, staying informed is the first step toward a healthier, more independent life. Stay tuned because the next part will reveal the 4 daily essentials that can truly make a difference, backed by solid science and practical guidance. Now let's shift the focus to the 4 daily allies that can truly transform your health, the ones that research consistently shows to support heart, brain, joints, and overall vitality. I'll walk you through each one, explain the science in plain terms, and give you a practical, easy-to-follow plan for incorporating them into your routine. By the end of this segment, you'll have a clear checklist you can start using tonight. First on the list is the marine powerhouse that has earned the nickname the golden fish oil. Omega-3 fatty acids, specifically eicosapentaenoic acid and docosahexaenoic acid, are the 2 most studied nutrients for seniors. Why do they matter? In simple terms, these long-chain fats become part of the cell membranes that line every blood vessel, nerve, and brain cell. When they are present in sufficient amounts, they keep the membranes flexible, reduce the production of inflammatory molecules, and improve the way blood cells glide past each other. The result is a lower risk of clot formation, better blood flow, and a calmer, more resilient brain. A meta-analysis of dozens of trials found that regular consumption of omega-3 reduces the odds of a major cardiovascular event by roughly 1/3 in people over 60. Moreover, studies on memory and cognition consistently report that participants who maintain adequate EPA and DHA levels experience slower age-related decline and better performance on tasks involving attention and recall.
The takeaway is clear. A modest daily dose of high-quality fish oil can act as a protective shield for both heart and mind.
So how do you translate that into an everyday habit? Look for a product that provides at least 500 milligrams of combined EPA and DHA per serving, and aim for a total of around 1,000 milligrams across the day. This can be achieved with 1 or 2 capsules depending on the concentration. Take the supplement with a meal that contains some fat. The presence of dietary fat enhances absorption. If you prefer a food-first approach, try to include fatty fish such as salmon, sardines, or mackerel at least twice a week. A serving the size of a palm-filled portion will provide a comparable amount of omega-3. And remember, if you are on blood-thinning medication, check with your physician before starting a high-dose regimen because the antiplatelet effect, while beneficial, can amplify the action of anticoagulants. Moving on, the second essential is a sunshine vitamin that many seniors unknowingly lack, vitamin D. Vitamin D acts like a master regulator for calcium metabolism, bone remodeling, and immune function. When sunlight hits the skin, a chemical reaction converts a precursor into the active form of vitamin D, which then travels to the liver and kidneys for final activation. In older adults, the skin's ability to synthesize vitamin D declines, and reduced outdoor activity can exacerbate the deficit. Low levels have been linked to higher rates of fractures, weakened immunity, and even mood disturbances such as seasonal affective disorder. Clinical trials have shown that maintaining serum vitamin D concentrations in the optimal range reduces the risk of falls by up to 30%, largely because stronger bones and improved muscle function go hand in hand. Additionally, vitamin D supports the brain's neuroprotective pathways, helping to clear out harmful proteins that accumulate with age. The practical recommendation is to aim for a daily intake that yields a serum level of around 30 nanograms per milliliter or higher. For most seniors, this translates to a supplemental dose of around 1,500 international units of vitamin D3 taken with the largest meal of the day to aid absorption. If you have a history of kidney stones or hypercalcemia, a lower dose may be appropriate, so a conversation with your healthcare provider is essential. A convenient way to meet this target is to choose a vitamin D3 supplement that also includes calcium because the two nutrients work synergistically. Take the capsule with a glass of fortified plant-based milk or sprinkle a vitamin D fortified powder into your morning oatmeal. If you spend time outdoors, aim for short, safe periods of sunlight exposure. 10 to 15 minutes on a clear day without sunscreen can contribute a meaningful amount, but remember that sunscreen blocks the UV rays needed for synthesis, so timing matters. Third on the list is a mineral that often flies under the radar but is indispensable for neuromuscular health: magnesium. Magnesium participates in over 300 enzymatic reactions, including those that generate energy, regulate blood pressure, and maintain a steady heart rhythm. As we age, dietary magnesium intake tends to decline, and the kidneys become less efficient at reabsorbing this mineral, leading to a silent shortfall that can manifest as muscle cramps, restless sleep, or irregular heartbeats. Research indicates that adequate magnesium intake is associated with a lower incidence of atrial fibrillation and can improve sleep quality by calming the nervous system. Moreover, magnesium works hand in hand with calcium to relax muscles after they contract, a balance that is crucial for joint health and preventing stiffness. The practical dosage that most studies point to for seniors is around 400 milligrams of elemental magnesium per day, split into 2 doses to maximize absorption and reduce the likelihood of digestive upset. Choose a chelated form such as magnesium glycinate or magnesium citrate, which are gentler on the stomach than oxide forms. A simple routine could involve stirring a tablespoon of magnesium-rich powder into your evening tea or taking a capsule with dinner and another with breakfast. Foods that naturally boost magnesium include leafy greens like spinach, nuts such as almonds, and legumes like black beans. Pairing magnesium with a modest amount of vitamin B6 can further enhance cellular uptake, so a combined supplement can be a smart choice. If you are on certain antibiotics or diuretics, discuss timing with your physician because some medications can interfere with magnesium absorption. Finally, the fourth ally is a bright yellow spice that has been celebrated for centuries, curcumin, the active component of turmeric. Curcumin is a potent anti-inflammatory and antioxidant compound that targets multiple pathways involved in chronic disease. In older adults, low-grade inflammation, often called inflammaging, contributes to a host of conditions from arthritis to cognitive decline. Curcumin can dampen the activity of inflammatory cytokines, protect neuronal cells from oxidative damage, and even improve endothelial function, which supports healthy blood vessels. One challenge with curcumin is its poor natural absorption. The solution that science has uncovered is to pair it with piperine, a compound found in black pepper, which can boost bioavailability by up to 2,000%. When formulated correctly, a daily dose of around 600 milligrams of standardized curcumin extract combined with a small amount of piperine provides a therapeutic effect without causing stomach irritation. Clinical trials have demonstrated that seniors who take this combination experience reduced joint pain, better mobility, and modest improvements in memory tasks. To make curcumin work for you, consider a high-quality supplement that specifies the percentage of curcuminoids and includes piperine. Take the capsule with a meal that contains healthy fats, a drizzle of olive oil over a salad, for example, because fat helps dissolve curcumin and enhances its uptake. If you love cooking, you can also incorporate turmeric into your dishes, but remember that culinary amounts are far lower than the therapeutic doses used in studies, so a supplement is the most reliable way to reach the effective level. People taking blood thinners should consult their doctor, as curcumin can have a mild anticoagulant effect. Now that we have explored each of the 4 daily essentials, omega-3 fatty acids, vitamin D, magnesium, and curcumin, let's pause for a moment and reflect on how they fit together. Think of them as a quartet of guardians, each covering a different aspect of the aging process: cardiovascular health, bone and immune resilience, neuromuscular stability, and systemic inflammation. When taken in harmony, they create a synergistic environment where your body can operate at its optimal level, reducing the need for higher medication doses and enhancing quality of life. You might be wondering, do I need to take all 4 at once? The answer is nuanced. If you already have a solid diet that provides some of these nutrients, for instance, you eat fish twice a week, spend time outdoors, and enjoy leafy greens, you may only need to supplement the gaps. The key is to assess your personal habits, any existing medical conditions, and the medications you are prescribed. A quick conversation with a trusted healthcare professional can help you tailor the regimen to your unique profile. Remember, supplements are meant to complement, not replace, a balanced diet and an active lifestyle. Before we wrap up, I'd love to hear from you. Which of these daily allies are you already using, and which ones are new to you? Have you noticed a difference in energy, sleep, or joint comfort after adding any of them? Drop your experiences in the comments below. Your story could be the catalyst that motivates another viewer to make a positive change. If the information resonated with you, please give this video a thumbs up. It signals the algorithm that more seniors are seeking reliable guidance, and it helps the channel keep delivering evidence-based content. And if you haven't already, consider subscribing and ringing the notification bell. By joining our community, you'll stay up to date on the latest research, practical tips, and hidden pitfalls that can affect health after 60. Our mission is to empower you with clear, actionable knowledge so you can maintain independence, vitality, and joy throughout your golden years. To recap, here's the concise checklist you can print or save on your phone. Include a high-quality omega-3 source that delivers at least 500 milligrams of EPA and DHA daily, taken with a fat-containing meal. Ensure your vitamin D intake reaches around 1,500 international international units of D3 each day, preferably with your largest meal, and monitor serum levels with your doctor. Add a chelated magnesium supplement, providing roughly 400 milligrams of elemental magnesium, split between morning and evening alongside magnesium-rich foods. Incorporate a standardized curcumin extract with piperine, delivering about 600 milligrams of curcuminoids daily, taken with a healthy fat meal. Each point is simple, affordable, and grounded in solid science. By integrating these 4 essentials into your daily routine, you're giving your body the tools it needs to combat inflammation, support vascular health, maintain bone strength, and keep your nervous system firing smoothly. Let's close with a final thought. Aging is not a sentence, it's a transition. The choices you make today shape how gracefully you move into the next chapter. Supplements, when chosen wisely, are a powerful lever you can pull to tip the balance toward health rather than disease. Stay curious, stay informed, and keep asking the right questions. Your future self will thank you. Thank you for watching, and until the next video, take care of your body, honor your experience, and keep thriving.